I come because of the people here. Getting to know them, getting to know their story, feeling connected to them.
I come to the summit each year because I'm required to by my employers. Just kidding. I come because it's absolutely one of my most favorite parts of every year. Collaboration with a bunch of providers from the community. It's a good time. It is some of the highest yield content for medical knowledge.
The question I got asked today is who here at the conference has inspired you and why? John Edwards Sr., it really spoke to my heart when he talked about what is really truly important, which is our family, our community, and the people that surround us.
One of the talks was specifically about how to view things through your patient's eyes. I've already kind of planned out how to spend 5 to 10 minutes every day to plan how to implement that exact practice of seeing things through my patient's eyes.
One incremental change that I made that made a big difference was I read a book called The Go-Giver, and since then I've focused a lot more on what I can give to a situation rather than what I can get out of a situation. It's made a very positive difference.
One of the biggest challenges I've overcame is, it's actually a really good question, the transition from nursing to this role as a rep. As a nurse, I had that you punch a clock and you go and work for those hours, you do that. To overcome those situations, it all kind of went back to communicate with others and try to help them to heal their patients quicker with the bone simulators.
This conference has just been a great way to get a lot of different disciplines together, learn a little bit more about what each of us does and how we fit into the whole puzzle to form a team to help patients feel better, I think is the biggest thing for me.
Well, there are a lot of conferences I attend that are really sort of technology focused or procedure focused, and this conference to me really is patient focused, between the patient stories and the interactions and the way every talk I've listened to today and every time I've come to this conference is really focused on, well, how did the patient do? What was the presenting symptoms and how was the outcome for that patient? I do think when people come to this conference, they get reset in the idea of, let me go back and listen a little more carefully to my patients, be a little more thorough in my evaluation, and see if I can't help them a little farther down the road to better health.
The content has been fantastic. I've really enjoyed hearing from so many different disciplines and being able to really see things from another perspective, but also feel like a part of a team. It's been really cool.
I really enjoyed Dr. McLean's presentation yesterday on spine alignment. In the orthopedic literature, it's just recently been emphasized the importance of that when you do hip replacement surgery. It helps you get the implants in the correct position if you understand spine curvature and alignment. And his presentation yesterday was the best I've ever seen on that. It's fascinating because I've studied the stuff in the Journal of Bone and Joint Surgery. Hard to understand it from there, but his talk was so clear. That, for me alone, was worth coming to the conference.
One lesson that I've learned at this conference that I hope to implement is longevity in my career. I haven't started my career yet. Learning about how to avoid burnout, enjoy what I do for the rest of my career so I could help as many people as possible is something that I've taken away from this conference.
A big moment was yesterday we were talking about burnout, taking time for ourselves so that we can be our best selves, to be able to give the best care to our patients. This conference is a great opportunity to be able to learn from a lot of other different providers.
I think attending things like this is such a neat part about continuing education. I think it's more than just taking coursework. I think it's networking. I think it's talking to people. I think it's connecting. But I find that self-growth helps me in my career just as much as knowledge about what I'm doing.
All the collaboration and insight from everybody has been super helpful, and I'm excited to be a part of that.
I'm most excited to take away any type of education that I can give to my nurses and PCTs to help them with their careers and taking care of the patients that we see on the floor.
Everything is all about people, and as an engineer, I like to solve problems. I like to work in the lab, I guess, and solve the device. But that piece of advice got me thinking, and it's so true. Even the work an engineer does is all about the people, whether it's the people you're working with or the people that the product is for. And so just remembering that everything is all about people.